Hey there, and welcome back to the Explorer's Life and Learning Hub. This is where we dive deep into health, science, and the wonders of the human body, all in a language we can actually understand. Today, we're talking about something that affects millions of women, yet often hides behind silence: uterine fibroids. They're non-cancerous, they're stubborn, and sometimes, they're downright painful. These growths can turn a normal cycle into a monthly battle, but they can also exist quietly, without a single symptom. So, what are fibroids? Why do they appear? And how do they affect pregnancy and fertility? Let's go inside her body and find out. What are uterine fibroids? Uterine fibroids, or leiomyomas, are non-cancerous tumors that grow in the muscle layer of the uterus. They can appear as a single lump or as clusters, ranging from tiny to large enough to mimic pregnancy. They're fueled by estrogen and progesterone, the same hormones that regulate the menstrual cycle. That's why they grow during reproductive years and shrink after menopause. Nearly 8 out of 10 women will have fibroids by the age of 50. Most will never even know. But for others, fibroids bring symptoms that can disrupt everyday life. How do fibroids form? Inside the uterus, a single muscle cell starts to grow differently. Instead of dividing and stopping like normal, it keeps multiplying. Over time, that cluster becomes a fibroid. Hormones feed the growth, and so do genetic factors. If your mother or sister had fibroids, your chances go up. Even lifestyle, like stress, diet, and weight, can play a role. Here are the different types of fibroids. Fibroids are classified by where they grow. Let's take a quick tour inside. Intramural fibroids, the most common type. They grow within the muscle wall of the uterus. These cause heavy bleeding and pelvic pressure. Submucosal fibroids, these grow just under the uterine lining and bulge into the cavity. They often cause fertility problems and prolonged bleeding. Subserosal fibroids, they grow on the outer surface of the uterus. They don't cause much bleeding but press on nearby organs, leading to back pain, constipation, or frequent urination. Pedunculated fibroids, these grow on thin stalks. If a stalk twists, pain can be sudden and severe. Cervical or parasitic fibroids, the rare ones. They grow in the cervix or attach elsewhere in the abdomen, sometimes affecting sex or childbirth. Every fibroid starts within the muscle, and as it grows, it may shift inward or outward. What are the symptoms? Some women never feel a thing. Others experience symptoms that interrupt their lives. Common signs include heavy, long periods, pelvic pain or pressure, bloating or abdominal swelling, frequent urination, constipation, back or leg pain. Fibroids enlarge the uterus and make its lining thicker, which means more blood loss during periods. If the bleeding is prolonged, it can lead to anemia, causing fatigue and dizziness. Now let's see the connection between fibroids and fertility. Fibroids can make conception harder, but not impossible. Only a small percentage of infertility cases are caused by fibroids. When they do interfere, it's usually because a submucosal fibroid blocks implantation. A large intramural fibroid alters the uterine shape. A fibroid near the fallopian tubes blocks sperm or eggs. Still, many women conceive naturally and have healthy pregnancies. Monitoring and medical care make all the difference. Fibroids during pregnancy, how is that? Fibroids can grow during pregnancy because of rising hormone levels. They may cause pain, cramping, or mild bleeding. Complications are uncommon but can include miscarriage or preterm birth, fetal malposition, like breech labor complications during the second trimester. Fibroids can outgrow their blood supply, a painful condition called red degeneration. The tissue breaks down, causing intense pain, but it usually resolves with rest and pain relief. After birth, fibroids often shrink as hormones settle. There is science behind the symptoms. Let's review this. Heavy bleeding. It's all about surface area. More fibroids mean more blood vessels in the uterus. The muscle struggles to contract normally, so bleeding lasts longer. Pelvic pain? The uterus is stretched and congested. Nerves are compressed. And sometimes, fibroids twist or degenerate, adding sharp pain to dull pressure. Back pain? That's often a large fibroid pressing against spinal nerves. It's not just discomfort, it's anatomy at work. Risk factors for fibroids. Who's most at risk? Black women, more likely, earlier, and often with more severe symptoms. Family history: if mom had them, odds are higher. Early menstruation, longer exposure to estrogen. Obesity and low vitamin D levels. Diets high in red meat and low in fruits and veggies. Even stress can play a role by altering hormone balance. Fibroid degeneration and rare changes. Fibroids can change form over time. Cystic degeneration: the fibroid fills with fluid. Calcific degeneration: it hardens like a calcium deposit. Red degeneration: painful breakdown during pregnancy. Sarcomatous change: extremely rare, when a fibroid turns cancerous. These changes are rare, but they explain why medical monitoring matters. How are fibroids diagnosed? Fibroids are usually found during a routine pelvic exam or ultrasound. Other imaging tests include MRI, for mapping large or complex fibroids. Hysteroscopy, a small camera to see inside the uterus. Laparoscopy, a tiny scope through the abdomen for surface fibroids. Knowing where fibroids are helps doctors tailor treatment precisely. Treatment options. Not every fibroid needs treatment. If symptoms are mild, watchful waiting may be best. When treatment is needed, options include: here are some of the treatments for fibroids. Hormonal birth control to regulate bleeding. GnRH agonists to shrink fibroids temporarily. Tranexamic acid to control bleeding without hormones. Non-surgical procedures: uterine artery embolization blocks fibroid blood flow. MRI-guided ultrasound destroys fibroids using focused heat. The role of surgery in managing fibroids. Myomectomy removes fibroids but preserves fertility. Hysterectomy removes the uterus entirely, a last resort. Every option depends on a woman's age, symptoms, and family plans. Very interestingly, let's now discuss fibroids and menopause. When menopause begins, estrogen drops, and so do fibroids. They shrink naturally in most women. But hormone replacement therapy can cause them to persist or grow. That's why postmenopausal care should be personalized. The role of emotional and social impact. Fibroids don't just hurt physically. They can drain energy, confidence, and intimacy. Heavy bleeding leads to fatigue. Pain affects mood and relationships. And fertility concerns add emotional stress. You're not alone. Millions of women share this journey. Talking about it and seeking help changes everything. Prevention and lifestyle is a key part of managing fibroids. We can't always prevent fibroids, but we can reduce risk. Keep a healthy weight. Eat a diet rich in fruits, vegetables, and whole grains. Limit red meat and processed foods. Get vitamin D, sunlight or supplements. Manage stress and stay active. Small habits. Big difference. As I move towards the end of this presentation, here is my take on this issue. Fibroids are common, complex, and often misunderstood. They're not your fault. They're not a reflection of weakness. They're simply part of the complex dance of hormones, genetics, and biology. With awareness, care, and science on your side, you can manage fibroids and thrive. Thanks for joining me here at The Explorer's Life and Learning Hub, where we bring science to life and health to light. If you learned something new today, hit like, subscribe, and tap the bell icon so you won't miss our next deep dive inside her body. Please also share your experience about this and let me know what you want to watch next. Stay curious. Stay informed. Stay empowered. And as always, explore more. Disclaimer: this information is purely for educational and entertainment purposes and not medical advice.